Have you ever wondered why heart attacks and strokes happen most often in the early morning hours, even in people who seemed perfectly fine the night before? After 30 years of cardiac surgery across 3 continents, I've stood in countless operating rooms facing this exact mystery. Today I'm going to share something that changed how I view heart health entirely, especially for anyone over 60. What I discovered isn't about dramatic symptoms or emergency room visits. It's about the quiet, everyday choices we make in those first crucial hours after waking up. Let me tell you about Margaret, a patient I'll never forget. She was 72, active, walked every morning without fail, took her medications religiously, and ate what she called a healthy breakfast. One Tuesday morning, she collapsed during her regular walk. When we examined her in surgery, we found a massive clot had formed in her coronary artery. Her daughter kept asking me the same question over and over: how could this happen to someone who did everything right? That question haunted me for months. So my team and I started looking deeper. We reviewed admission records, interviewed hundreds of cardiac patients about their morning routines, and studied the latest research on blood clot formation. What we found was startling. The problem wasn't what these patients were doing. It was what they weren't doing, or more precisely, what they were doing wrong in those critical first 60 to 90 minutes after opening their eyes. You see, your blood doesn't behave the same way at 8 in the morning as it does at 8 at night. After 60, these differences become even more pronounced, and certain morning habits that seemed perfectly harmless for decades suddenly become silent threats to your cardiovascular system. The evidence is overwhelming, yet somehow this information rarely reaches the people who need it most. Your body undergoes remarkable changes during sleep. Your heart rate slows, blood pressure drops, and you lose fluid through breathing and perspiration. By morning, the average person has lost between 1 and 2 cups of water. For someone over 60, this matters tremendously because total body water naturally decreases with age. Your blood becomes thicker, more viscous, like honey left out overnight instead of the smooth, flowing liquid it should be. Now here's where it gets dangerous. Many seniors, perhaps even you, wake up and immediately reach for coffee, check the morning news, or rush to start their day. But that glass of water, that gets forgotten. A study published in Thrombosis Research demonstrated something remarkable. Even mild dehydration significantly increases blood viscosity and causes platelets, those tiny cell fragments responsible for clotting, to become stickier and more likely to clump together. This is happening inside your arteries right now if you haven't had water this morning. Think about what this means. You're asking your aging, less flexible arteries to push thicker, stickier blood through smaller spaces, all while your natural morning blood pressure surge is already putting extra strain on your cardiovascular system. The risk of clot formation rises dramatically, yet you feel completely normal. There's no pain, no warning, nothing to alert you that danger is building inside your vessels. The solution sounds almost too simple to matter, but the clinical evidence is clear. One full glass of room temperature water within 10 minutes of waking, before your coffee, before checking your phone, before taking supplements, can restore plasma volume and lower blood thickness enough to significantly reduce clot formation risk. Not after your morning routine, not with your breakfast, first thing. This single habit has more impact on morning cardiovascular protection than most people realize. But dehydration isn't the only silent threat lurking in your morning routine. Let me ask you something. How does your typical morning begin? Are you rushing, checking upsetting news, jumping straight into problems and worries? If you're over 60, this pattern is far more dangerous than you might think. Your stress response system changes with age. When you wake up stressed or suddenly rush into activity, your body releases cortisol and adrenaline faster and in higher amounts than it did when you were younger. Even more concerning, these hormones stay elevated longer. This isn't just about feeling anxious. These stress hormones cause your blood vessels to constrict, your heart rate to increase, and your blood pressure to spike. Remember that already thickened blood we talked about. Now it's being forced through constricted vessels at higher pressure, creating turbulent flow patterns that encourage platelets to stick to vessel walls. Research published in the European Heart Journal found that acute emotional stress significantly increases platelet activation and clotting potential, especially during those early waking hours. The combination of natural morning blood pressure surge plus sudden stress creates what cardiologists call a perfect storm for clot formation. Yet how many mornings do we create this exact scenario for ourselves, completely unaware of what's happening inside our arteries? The morning walk that so many seniors rely on for heart health doesn't reverse this damage. Once that cortisol and adrenaline cascade begins, once those platelets activate and blood vessels constrict, simply moving your body doesn't reset the system. The inflammatory, clot-prone state persists. This is why cardiac events happen during or immediately after morning exercise more often than any other time of day. Creating a calm morning routine isn't about avoiding activity, it's about the order of operations. Start with quiet, slow breathing, sitting peacefully for even 5 minutes before engaging with news, problems, or rushing. This allows your cardiovascular system to transition gradually from sleep to activity, maintaining the flexibility and balance your aging vessels need. Now let's talk about breakfast, because this is where I see some of the most well-intentioned people make devastating mistakes. After 60, your body's ability to handle sugar changes dramatically. Insulin sensitivity decreases, meaning blood glucose spikes sharper and stays elevated longer after eating. Walk into any senior center dining room and what do you see? White toast with jam, sweetened cereals, fruit juice, pastries. Foods that were staples for decades suddenly become cardiovascular time bombs. Here's why this matters so much for clot formation. When blood sugar spikes after a high-sugar breakfast, it triggers inflammation inside your blood vessels. This inflammation makes platelets more reactive, more likely to clump together. A groundbreaking study in the Journal of the American College of Cardiology showed that post-meal sugar spikes increase platelet activation and clotting markers within hours of eating. Not days or weeks, hours. The damage doesn't stop there. Sugar-induced inflammation reduces nitric oxide production in your arterial walls. Nitric oxide is crucial for keeping blood vessels relaxed and flexible. Without it, vessels constrict more easily, blood flow becomes restricted, and the risk of clot formation climbs higher. Repeat this pattern every morning for months or years, and you create a chronic inflammatory, clot-prone environment in your bloodstream, all while feeling perfectly fine. The solution isn't complicated, but it does require changing habits that might feel comforting or traditional. Protein, healthy fats, and fiber should form the foundation of your breakfast. Eggs with vegetables, plain yogurt with nuts, avocado, foods that slow sugar absorption and keep blood chemistry stable. This isn't a diet, it's cardiovascular protection disguised as breakfast. Speaking of morning rituals, let's address America's favorite drug, caffeine. That morning cup of coffee feels essential, doesn't it? The warmth, the ritual, the energy boost. But for anyone over 60, how and when you consume that coffee matters more than most people realize. Caffeine sensitivity increases with age. The same cup that barely affected you at 40 now triggers a much stronger cortisol and adrenaline response at 70. When you drink coffee on an empty stomach, especially black coffee, it gets absorbed faster and hits your system harder. Blood vessels constrict sharply, blood pressure elevates. And here's what surprised even me when I reviewed the research. Clinical nutrition studies show that caffeine alone significantly increases platelet aggregation, that dangerous clumping we've been discussing. There's another problem. Drinking coffee first thing suppresses your body's natural hydration signals. Remember, you're already dehydrated from sleep. Now you're adding a diuretic that makes you lose even more fluid while simultaneously triggering a stress response that constricts blood vessels and activates platelets. The timing couldn't be worse for your cardiovascular system. The fix is straightforward. Drink water first always, then have a small amount of protein or healthy fat with your coffee, a handful of nuts, a slice of cheese, anything that slows caffeine absorption and moderates that hormonal spike. Your morning walk won't reverse caffeine-induced vessel constriction that's already happened. Prevention is the only effective strategy. Now we need to discuss something that catches many seniors completely off guard: supplements and medications. After 60, your liver metabolism slows and kidney filtration becomes less efficient. This means substances stay in your bloodstream longer and interact in ways that become increasingly unpredictable. Taking supplements like calcium, iron, or high-dose vitamin K immediately after waking, especially without food or water, can alter blood thickness and clotting pathways in dangerous ways. Pain medications, particularly NSAIDs that many seniors take regularly, can irritate blood vessel lining and affect platelet behavior, especially on an empty stomach. A comprehensive review in the American Journal of Medicine linked improper medication timing with increased clotting complications in older adults. Morning is already the peak time for blood pressure elevation and platelet activity. Adding multiple substances to your bloodstream without proper spacing or food intake amplifies clot formation potential dramatically. The pharmaceutical interactions your doctor discusses usually focus on obvious drug conflicts. What gets missed is timing. How substances interact with your body's natural morning cardiovascular state. Taking medications with food and adequate water, spacing doses appropriately throughout the day rather than dumping everything in your system at once. These simple adjustments reduce sudden concentration spikes that can trigger clotting cascades. Let me shift now to something that seems completely harmless, but accounts for more clotting events than most people imagine: sitting. After 60, vein elasticity decreases and the muscle pump in your legs weakens. These muscles normally squeeze veins and push blood upward against gravity back toward your heart. When they're not working, blood pools in your lower legs, particularly your calves, which happen to be the most common site for dangerous clot formation. Many seniors have a routine. Wake up, make coffee, sit down with the newspaper or television or phone and stay there for an hour or more. Research published in Circulation found that prolonged sitting reduces venous blood flow and increases clotting markers even in otherwise active older adults. Combine this with morning dehydration and naturally thicker blood, and you've created ideal conditions for venous thrombosis. Here's what makes this so insidious. The clot forms silently. No pain, no obvious swelling in the early stages, nothing to warn you that a potentially fatal clot is developing in your leg. Slow blood flow increases platelet contact with vessel walls, giving them time and opportunity to stick and start the clotting cascade. One study found that breaking up sitting with just 2 minutes of light activity every 30 minutes reduced clotting markers by over 40%. Standing up and stretching every 20 to 30 minutes after waking isn't optional anymore. It's cardiovascular protection. Simple movements, ankle pumps, leg extensions, walking to the kitchen for more water, these aren't exercise, they're clot prevention. And no, taking one morning walk later doesn't negate the risk created by extended sitting periods. The damage happens during the sitting, not after. But here's what cardiac surgeons consider the most dangerous morning habit of all, the one that lands more patients in emergency surgery than any other: ignoring your body's warning signals. After 60, your blood pressure naturally surges in the morning as your body transitions from sleep to activity. When your arteries are stiff and less flexible, this surge puts tremendous stress on your cardiovascular system. Unstable plaque can rupture, thickened blood can form clots, and the combination becomes lethal. Your body tries to warn you. Dizziness, pressure in your head, unusual shortness of breath, heart racing or pounding, these aren't just normal aging. These are your cardiovascular system telling you something is wrong. Yet I can't count how many patients dismissed these exact symptoms for weeks or months before a major cardiac event. They attributed it to getting older, to needing more coffee, to anything except the truth: their heart and vessels were struggling. Research in hypertension demonstrates that heart attacks and strokes peak in early morning hours, directly linked to these unchecked blood pressure spikes. What makes this habit so deadly is the repetition. Every morning the dangerous pattern repeats. Every morning a little more damage accumulates in vessels and heart tissue. The warning signs are there, but they get ignored until something catastrophic happens. Simple actions make enormous differences. Sitting quietly for a few minutes after waking, practicing slow breathing to help stabilize blood pressure before jumping into activity, monitoring your blood pressure at home a few times each week to understand how your body responds to morning stress. These aren't burdensome medical interventions. These are survival skills for anyone over 60. Adjusting medication timing based on morning blood pressure patterns, ensuring proper hydration before activity, moderating the pace of your morning routine. These adjustments lower clot risk more effectively than most medications. But they require paying attention to your body and taking those signals seriously. Walking immediately after ignoring warning signs doesn't help. In fact, it often makes things worse because you're stressing an already struggling cardiovascular system. I want to be absolutely clear about something. Everything I've shared today is based on decades of clinical experience and peer-reviewed research. These aren't theories or possibilities. These are proven mechanisms of clot formation and cardiovascular damage that happen every single morning in millions of seniors who have no idea they're at risk. The remarkable thing is how preventable this all is. You don't need expensive treatments or complicated medical interventions. What you need is awareness and willingness to adjust habits that feel normal but are quietly endangering your life. Start with hydration. 1 glass of water first thing every morning, that's step 1. Create calm in your morning. Give your cardiovascular system time to transition from sleep to activity without the added burden of stress hormones flooding your bloodstream. Choose breakfast that stabilizes blood sugar instead of spiking it. Have food with your coffee, not coffee with your eventual food. Take medications and supplements properly with adequate water and food, spaced appropriately throughout the day. Move regularly after waking. Don't sit still for extended periods. Your leg muscles need to pump blood back to your heart, and perhaps most importantly, listen to your body. Pay attention to morning symptoms. Monitor your blood pressure at home. Recognize that your 60-plus-year-old cardiovascular system has different needs and vulnerabilities than it did decades ago. I've seen patients make these changes and transform their cardiovascular health in a matter of weeks. Blood pressure stabilizes, energy improves, and most significantly, the silent clot formation risk drops dramatically. Your heart has been beating faithfully every moment of your life, pumping blood through thousands of miles of vessels, delivering oxygen and nutrients to every cell in your body. It deserves your attention and protection, especially in those critical morning hours when it's most vulnerable. One more thing I want you to understand: the changes I've described aren't about living in fear or becoming obsessed with health. They're about respect. Respect for the aging process and the reality that your body needs different support now than it did when you were younger. There's no shame in acknowledging this, there's only wisdom. Margaret, the patient I mentioned at the beginning, survived her cardiac event. During her recovery, we had long conversations about her morning routine. She couldn't believe that simple habits she'd practiced for decades were the very things that nearly killed her. She made every change we discussed. 2 years later, she's still walking every morning, but now she starts with water, creates calm, eats protein for breakfast, and listens to her body's signals. She tells everyone who will listen about what she learned. You have the same opportunity Margaret had. The question is whether you'll take it before a crisis forces you to, or whether you'll make the changes now while you still have time and health on your side. Your circulation is working right now to keep you alive, delivering oxygen to your brain so you can hear these words, pumping nutrients to your muscles so you can move through your day. Those morning hours set the tone for how well your cardiovascular system functions all day long. So here's what I want you to do. Tomorrow morning, before anything else, drink a full glass of water. Sit quietly for 5 minutes. Choose a breakfast built on protein and healthy fats instead of sugar. Notice how your body feels. Pay attention to any symptoms that might be warning signs. Make one change, then another, until these protective habits become as automatic as the dangerous ones they're replacing. Your heart doesn't ask for much. Clean blood flowing through flexible vessels at reasonable pressure. Morning is when that system faces its greatest challenge. Give it the support it needs. The life you save will be your own, and the years you gain will be filled with the independence, energy, and vitality that make life worth living. If you found this information valuable, share it with someone you care about who's over 60. Leave a comment about which morning habit surprised you most or what changes you're committed to making. Your story might be exactly what someone else needs to hear to take their cardiovascular health seriously. Subscribe to this channel for more evidence-based health information that can genuinely change and extend your life. Remember, knowledge without action is just interesting information. Action is what saves lives.